Hello, my name is Ashley Jackson, and I am going to be talking about ovarian cancer today. To start, I want to note that ovarian cancer is the leading cause of death in women from gynecologic malignancy and the fifth leading cause of cancer mortality in American women overall. The American Cancer Society estimates that in 2016, 22,280 new cases of ovarian cancer will be diagnosed, and 14,240 women will die from this disease. The cause of ovarian cancer is still unknown, but there are many factors that give a woman an increased risk for developing the disease. First, we have the risk factors in the area of family history or genetics. If a woman has a family history of ovarian cancer, either in a first-degree relative such as a mother or a sister, or a second-degree relative such as a grandmother or an aunt, if she is Caucasian, or if she is of Ashkenazi Jewish descent, and then the inherited genetic mutation of either BRCA1 or BRCA2. BRCA1 has a 15 to 45% increased risk, and BRCA2 has a 10 to 20% increased risk. Now we have risk factors that are related to increased ovulation, such as early menstruation or late menopause. Then there are women who have never been pregnant, which is called nulliparous, because when you're pregnant, the ovaries are at rest from ovulation during that time. Women who have been pregnant have a 50% decreased risk. There is also a risk when using the drug called Clomid, which stimulates ovulation in infertility patients. If it is used for an extended amount of time and the woman doesn't get pregnant, that poses a higher risk as well. So it seems that this theory suggests that ovaries are sensitive to the trauma of ovulation. So the symptoms of ovarian cancer usually don't present themselves until it's too late, meaning that the disease has already progressed to an advanced stage. Even then, the symptoms are mild and usually brushed off and assumed to be something minor. The symptoms that a woman might have include abdominal pain or swelling, or ascites, which is the result of fluid buildup in the abdomen, feeling full quickly when eating, indigestion, and postmenopausal bleeding. Like I stated previously, usually the symptoms don't present themselves until advanced stages, so ovarian cancer is termed a silent killer. Now I will explain the different types of ovarian cancer tumors and the tissue types each of them are associated with. First, we have the primary epithelial tumor, which is the most common. 90% of all ovarian cancer cases are usually primary epithelial. They arise in the epithelial cells covering the ovary, and they include serous and mucinous tumors, cystadocarcinomas, endometrioid tumors, and mesonephric clear cell tumors. Then there's the germ cell tumor, which develop in the ovum of the ovary, and they include the endodermal sinus malignant tumors, embryonal carcinomas, immature teratomas, and dysgerminomas. And lastly, there is the stromal cell tumor, which develop in the stroma, which is connective tissue, and they include granulosa cell tumors, fecomas, and Sertoli-Leydig tumors. And here are some photos that show you what the tumor types look like. For primary epithelial, we have serous type and cystadocarcinoma. For germ cell tumors, we have dysgerminoma and mature cystic teratoma. And for stromal cell tumors, we have the granulosa cell and the Sertoli-Leydig tumor. Now we'll describe the pathological and systemic changes caused by ovarian cancer. On the cellular level, all of these types of tumors that I just talked about are going to mutate the basic functions of the cell, take over the healthy cells, and then they will multiply and establish an adequate network of blood vessels to feed the mutations and therefore the tumor. For changes in system functions, changes will occur in a few systems, but first we have the reproductive system, of course. Some tumors will produce estrogen, which will cause abnormal bleeding, which is bleeding in a woman who is postmenopausal or a prepubescent young woman will bleed too early or develop breasts before puberty as well. Sometimes tumors will produce testosterone, but not that often. Testosterone-producing tumors can cause menstrual bleeding to stop, and then women won't get their period at all. And the increased testosterone in women can cause an abnormal increase in hair growth on the face or the body. And then we have changes that arise from the removal of the ovaries, which I will talk about in a few minutes. But when the ovaries are removed, women are no longer able to produce children, and then it puts them in automatic menopause, which give them vasomotor symptoms such as hot flashes, night sweats, and emotional changes. Then there are changes in the lymphatic system, such as lymphedema, which is swelling in the lymph nodes, which occur when lymph remains in the tissues because the lymphatic system is unable to transport the filtrate. The flow of lymph is interrupted due to the malignancy and or surgery for the malignancy, and then the lymph just remains in the tissue. The functional changes in the urinary system are caused if the tumor grows too large or in a certain direction. The tumor can put pressure on the ureters that drain the kidney, blocking the flow of urine. And if the urine can't drain away from the kidney, it causes the kidney to swell and become damaged. Functional changes in the gastrointestinal system result from the tumor blocking the bowel, and that'll cause a bowel obstruction. The waste from food that's digested and fluids produced in the stomach cannot get past the blockage, and this will cause constipation, bloating, feeling full, or vomiting. Now we have staging, which is the term used to determine if the cancer is localized or if it has spread or metastasized to other parts of the body. And staging is done by a procedure called a laparotomy. First, we have stage 1, which is when cancer is found in one or both of the ovaries. Stage 2 is in one or both ovaries and fallopian tubes, and or has metastasized to the uterus. So this is stage 3A, and 3A is when the cancer is in one or both ovaries and fallopian tubes, has metastasized to the lymph nodes outside of the peritoneum, which is the lining of the abdominal cavity, and some microscopic cancer cells might have spread to the omentum, which is a fold of the peritoneum that connects the stomach with the other abdominal organs. Stage 3B is when the cancer is in one or both ovaries and fallopian tubes, has metastasized to the omentum with a tumor that is 2 centimeters or less, and to the lymph nodes behind the peritoneum. Stage 3C is when the cancer is found in one or both ovaries and fallopian tubes, metastasized to the omentum with a tumor larger than 2 centimeters, and has metastasized to lymph nodes behind the peritoneum and to the surface of the liver or the spleen. Then we have stage 4, which is the most advanced stage, and that's when the cancer has metastasized beyond the abdomen to other parts of the body, such as the fluid around the lungs themselves, the liver, bone, or lymph nodes in the groin. Now I will talk about treatment, prevention, and prognosis of ovarian cancer. The treatment for ovarian cancer involves surgery and chemotherapy. The type of surgery will depend on the staging of the cancer. If the cancer is only stage 1, then all that will need to be removed is that ovary and its associated tube. This is usually done when the patient wishes to preserve childbearing and if she is young enough to do so. However, if the cancer is more extensive, such as stage 2 or higher, then a TAH-BSO, or total hysterectomy, and bilateral salpingo-oophorectomy, and possible lymph node dissection if there are diseased lymph nodes involved. Chemotherapy treatment will begin usually right after surgery. The initial chemotherapeutic approach involves the use of drugs called carboplatin and paclitaxel. Carboplatin is an anti-neoplastic which disrupts cancer cell growth, and paclitaxel actually prevents cell division, which in turn slows disease progression. Both are delivered by IV infusion and require 6 rounds to complete the therapy. Unfortunately, since we don't know the cause of ovarian cancer, it isn't preventable. However, there are ways to reduce the risk of development. If you remember, I explained the risk factors associated with the development of the disease. So the ways to reduce these risks include suppressing ovulation, either by pregnancies or oral contraceptives. The use of oral contraceptives actually has a 50% decreased risk for developing ovarian cancer because of its role in suppressing ovulation. Patients with genetic risk factors such as family history should have genetic testing done to test for the BRCA1 or BRCA2 gene mutation. If positive for the BRCA1 or BRCA2 mutation, and they're younger than 35 years old, surgeons will usually perform a prophylactic oophorectomy if they're done with having kids. If they're older than 35 years old or postmenopausal, then a prophylactic TAH-BSO will be done. If the gene mutation for BRCA1 or BRCA2 is negative, the patient is still considered high risk due to their strong family history, so they should still consider prophylactic surgery even if their childbearing is completed. The prognosis for ovarian cancer is poor because the disease is usually in advanced stages by the time the patient is diagnosed. The overall survival rate without evidence of recurrent disease is 15% to 45%. With early diagnosis, aggressive surgery, use of new chemotherapy medications, the rate actually approaches 70%. Finally, I will describe short and long-term consequences of ovarian cancer. The short-term consequences for chemotherapy alone are little to no appetite, unable to taste, nausea and vomiting, and acute fatigue. The short-term consequences for ovarian cancer are a low immune system, increased risk of getting sick, increased risk of infection, anemia, and lymphedema. Then we have long-term consequences, which can develop over time or develop with the initial diagnosis of ovarian cancer and progress over time. The long-term consequences for chemotherapy include heart disease, lung disease, dental problems due to the loss of the enamel on your teeth, and increased risk of osteoporosis. The long-term consequences for ovarian cancer include menopausal symptoms due to the removal of the ovaries. This will automatically put you in menopause. Severe emotional changes such as anxiety and depression, PTSD, and increased risk of recurrent disease. And this means that a patient has a risk of developing colorectal cancer, breast cancer, bladder cancer, leukemia, and melanoma of the eye. This concludes my presentation on ovarian cancer, its etiology, pathophysiology, systemic and functional changes, the signs and symptoms of ovarian cancer, the treatment for and prevention of ovarian cancer, the prognosis, and the short and long-term consequences resulting from ovarian cancer. Thank you so much for listening.